Graves' disease was first discovered by Robert J. Graves. He noticed it in a patient in 1835. Graves' disease is a type of autoimmune problem that causes the thyroid gland to produce too much thyroid hormone, which leads to hyperthyroidism. There are many thyroid gland autoimmune problems. Researchers do not completely understand what causes autoimmunity, although there seems to be a genetic connection, as cases of Graves' disease tends to run in families. Studies show, for example, that if one identical twin contracts Graves' disease, there is a 20% likelihood that the other twin will get it too. For unknown reasons, like many autoimmune diseases, Graves' disease is also more likely to affect women than men. In Graves' disease, your immune system creates antibodies that cause the thyroid to grow and make more thyroid hormone than your body needs. These antibodies are called thyroid-stimulating immunoglobulins. The TSIs bind to thyroid cell receptors, which are normally docking stations for thyroid-stimulating hormone. The TSIs then trick the thyroid into growing and producing too much thyroid hormone, leading to hyperthyroidism. Common symptoms include weight loss despite increased appetite, anxiety, heat intolerance, chest pain, shortness of breath, increased stool frequency, irregular menstrual periods, muscle weakness, along with difficulty controlling diabetes. Some of the physical signs of Graves' disease are a goiter, which a goiter is an enlarged thyroid gland. As the thyroid gets bigger, the patient's neck may begin to look full or swollen, and it sometimes makes swallowing difficult, causing coughing, and may disrupt sleep. Eye problems connected to Graves' disease can go from very mild to very severe. The symptoms include red eye, tearing, a feeling of sand or dust in the eye, and insensitivity to light. In more severe cases, one or both eyes may protrude from the eye sockets. Also, some patients with Graves' disease may develop thickening of the skin over the front of the lower leg called the tibia. The disorder usually causes skin lesions that are patchy and pink. With proper treatment, you can minimize the effects of Graves' disease. The goal of treatment is to control overproduction of thyroid hormones. There are 3 treatment options for Graves' disease. The first is anti-thyroid medications. These drugs help prevent the thyroid from producing hormones. Methimazole and PTU are generic medications that interfere with the thyroid gland's ability to produce hormones. Second is radioactive iodine, which is given as a capsule or in a water-based solution. Radioactive iodine works by destroying thyroid tissue cells, thereby reducing your thyroid hormone levels. The goal of RAI treatment is to leave enough thyroid tissue for production of a healthy balance of hormones, but many, if not most, patients eventually develop hyperthyroidism. Lastly, some patients may require surgery for various reasons. For example, some people cannot take or tolerate anti-thyroid medication or RAI, and sometimes these treatments are not successful. Additionally, if you're pregnant and PTU isn't working, the doctor may recommend surgery. While total removal of the thyroid effectively treats hyperthyroidism in most patients, it always results in hypothyroidism. Therefore, if you undergo a total thyroidectomy, you will need to take a thyroid replacement hormone every day.